All right. Good morning, everyone. I'm Megan Dayton, Mape Statewide President and Senior Demographer for the Minnesota State Demographic Center in the Department of Administration. I'd like to warmly welcome members of Minnesota Management and Budget in their team as we begin negotiating Mape's contract for the 2021-2023 biennium. I'd also like to welcome members of Mape's Negotiations Committee. I'm proud to be a member of this hardworking, brilliant, and creative team. Our 26 democratically elected members represent more than 15,000 people in over 100 agencies, from Moorhead to Marshall and Ada to Zumbrota. And one more enthusiastic good morning welcome to all Mape members who are watching today's opener in real time. 2 years ago, I was appointed to represent my region on the negotiations committee. Hello, Region 7. And it immediately sparked my interest in getting more involved in Mape. It showed me the value, actually the necessity of a union, as well as the importance of collectively organizing around a healthier workplace and its impact not only on Mape members, but workers across the state as well. Mape members stepped up from the first day COVID-19 hit our state, and we haven't stepped down, not once, no matter how hard it's been. We are the frontline workers, the epidemiologists, the case managers in corrections, the unemployment insurance analysts, the grant specialists at Minnesota State, helping students continue their education. We have been central to Minnesota's quality of life and the care and relief of its residents throughout the pandemic. The services we provide will continue to be key to an equitable recovery that includes alleviating the economic and emotional toll COVID-19 has taken on our communities. Together, we've experienced COVID-19 working from home, witnessing racial injustice, contentious elections, and other national events, all while providing extraordinary public services. Our state requires maintaining a continuity of public service for a successful recovery, and that includes continuity for our contract. A new study from Save the Children shows that children in Minnesota are faring the best in the nation during the COVID-19 pandemic. US News and World Report recently named Minnesota the second best state in the country. Like those two examples show, Minnesota is often at the top of the national best of lists, and this isn't by chance. This is due to bold government leadership and to the well-qualified state employees who provide the much lauded state services Minnesota is known for. As Governor Walz recently said, we're at the top of the list because Mape works, and Mape makes Minnesota work. Minnesota leads many of best of lists that we can be proud of, but like many states, Minnesota is at a crossroads. The death of George Floyd and the consequent trial going on now in Minneapolis have further exposed existing disparities and systemic racism in our state and the nation. The pandemic's only making racial inequality worse. In Minnesota, as across the nation, Indigenous and people of color are more likely than white people to live in poverty. Shockingly more likely, actually. According to the Minnesota State Demographic Center's 2018 report, The Economic Status of Minnesotans, that I co-authored, African-American Minnesotans are 4 times as likely to be living in poverty as white Minnesotans. 4 times. That's 34% and 8% respectively. Differential access to opportunity and structural racism back through generations and right up to the present have contributed to these and other widely disparate economic outcomes by race. The state of Minnesota has one of the nation's widest educational achievement gaps between Black and white residents. In 2019, we ranked dead last in racial disparities for high school graduation rates. Racial inequality in Minneapolis is among the worst in the nation. The economic gulf between Black and white families is higher in Minneapolis than nearly anywhere else in the United States. According to Census Bureau data, the typical Black household in Minneapolis earns only 44% as much as the typical white household. That's $36,000 and $83,000 respectively. 3 out of every 4 white families in Minneapolis owns their own home, compared to 1 out of every 4 Black families. The area had a long history where racial covenants made it hard for Black residents to become home buyers and live in neighborhoods dominated by white homeowners. In 2019, the incarceration rate of Black individuals in the Twin Cities was 11 times higher than for white individuals. Top of the list, but only for some. I can't hear any more about how great Minnesota is unless we are also acknowledging that's only for a handpicked few of us. For the rest of us, Minnesota is actually the worst, yet we stay. We stay and work tirelessly to improve our quality of life. State government has the opportunity, actually the obligation, to lead the way on eliminating these disparities and systemic racism. As more and more Minnesotans receive vaccination, there's greater talk about returning to normal. We have to recognize that for many Minnesotans, getting back to normal isn't good enough. It should not be normal that students in small towns across the state have to do their homework in the parking lot of a local restaurant or their high school because they don't have a good internet connection. Parents shouldn't have to work 2 or 3 jobs to support their families. It's not good enough that people of color have to be fearful of being stopped by police officers who have taken an oath to protect them. Mape members are prepared to do whatever we can to help make our state more equitable for all Minnesotans. Mape members believe government service is noble. We truly enjoy serving our fellow Minnesotans and we want to do right by them. But we need more resources so we can serve our state to the best of our ability. Many state government jobs are chronically short-staffed, particularly those in corrections and direct care and treatment programs in the Department of Human Services. The Safety in State Correctional Facilities report by the Office of the Legislative Auditor noted that persistent staffing shortages have threatened the safety and security of both staff and offenders alike. Understaffing has plagued facilities at all levels, placing a limit on critical resources to support successful reintegration from prison to community. The lack of competitive salaries creates additional challenges with retention and recruitment of skilled professionals. We would like to see an approach that centers the staff person providing rehabilitation and reintegration as much as the incarcerated person receiving their care and concern. Direct care and treatment programs serve Minnesota's most vulnerable, and yet the low wages offered for this work makes it difficult to keep positions filled. Corrections and direct care and treatment are not the only programs that are short-staffed and hurt by offering wages that are not competitive. We need adequate resources to do our jobs and provide the services that Minnesotans rely on. Positions need to pay competitively so that we can fill them with public servants ready to do the job. Salaries need to keep up with inflation so we can support ourselves and our families while we support Minnesotans recovering from the pandemic. We deserve a fair cost of living adjustment. In our next contract, we need to hold the line on healthcare by preserving the quality and the cost. We don't want to go backward, particularly now, given the vulnerability we and our families face in terms of health risks. When we recently met with Governor Walz and MMB Commissioner Showalter, the governor urged the commissioner to find a working solution that ensures healthcare benefits and healthcare necessities are satisfactory to everyone involved. Commissioner Showalter said MMB was committed to working with us, and both he and the governor are aware of how important affordable healthcare is and the role it plays in making the state employment viable and rewarding. The proposals we're bringing forth for the 2021-2023 contract do not only pertain to Mape's more than 15,000 members, but also to the 5.7 million Minnesotans we proudly serve. The proposals will also benefit managers and their teams in state agencies. In addition to our relief and recovery during the pandemic, we have reimagined state work sites in Minnesota, and these proposals will help make the workplace better for everyone. We are hopeful that there can be a different approach to bargaining this cycle. At our summit with Governor Walz, he expressed his expectation of collaboration from his MMB negotiations team to ensure we're solving problems and improving Minnesota through our contract. So in the spirit of collaboration, our proposals are written to address specific problems identified broadly by our membership. We're excited to find common ground solving these problems. We hope and expect that collaboration means something similar to your team, including responding to each proposal in detail, sharing concerns or barriers, and looking for a path forward on each of the ideas. Now, this morning, we won't be talking about all the proposals in detail. That will occur at subsequent bargaining meetings, so we'll cover them briefly today. Our proposals are grouped into 4 themes. The first is equity, diversity, and inclusion. The second is a healthy workplace. The third is mental health and well-being. And finally, attraction and retention. So at this point, I think I've spoken enough, and I'm going to turn it over to negotiations co-chair Adam Novotny, who is a principal program administrator with the Department of Corrections. Adam will discuss some of the equity, diversity, and inclusion proposals. And he, along with his negotiations co-chair, Carolyn Murphy, have done an absolutely terrific job leading our bargaining team so far. Thank you both for the hard work you've done to get us to this point in the process. Adam, the floor is yours.
Thank you, Megan. So I'll be kicking off the proposals today under a theme that has never been more relevant or demanded than it is right now, and that is the theme of equity. The public has spoken, state leadership echoes, and our members agree. Equity, diversity, and inclusion should be desired by all who live in Minnesota and all those who work in Minnesota. Today, we present proposals that will bring the state as an employer and our members as a workforce more in line with these ideals. These proposals will provide an opportunity for the marginalized and allow us to lead in tandem on equity. We seek tangible and measurable outcomes that will improve existing protocols and desire to help the state be a leader in EDI initiatives with the following proposals. Quickly go over the technical notes. Number one, all new sections or articles in the accompanying proposals are simply designated Section X to be properly numbered once a tentative agreement is reached. Number two, change all dates as necessary to reflect the new terms of the agreement. And three, the association retains the right to modify, add to, or delete these proposals. So our first proposal is a commitment to anti-racism and emphasizes the importance of equity, diversity, and inclusion to the state workforce. Second proposal is around the Connect 700 program, which will improve accommodations for the Connect 700 participants prior to beginning the job for successful integrations into the workforce. This new language will correct double probationary periods, equity and sick leave allowances, request a review of a termination, and provide union representation at supervisor meeting check-ins. The third proposal is around temporary unclassified. As the state is aware, Mape has concerns with the agency's misuse of the temporary unclassified designation. The statute that allows this designation clearly states that it should be used only for positions which are fully anticipated to be of limited duration. Yet the state allows too much discretion for agencies and not enough transparency or predictability for employees. We've seen many of these positions be used for roles with long-term need and projects that go well beyond 3 years. Therefore, Mape has proposals that aim to define the state's use of this designation and require documentation be provided to the union and employees upon the creation of such positions. There are several disparities in the current agreement in how unclassified employees are treated compared to their classified colleagues, many of whom do the same work. Mape's proposals aim to create parity between these designations. There's also a problem of racial equity. From a recent survey, we found that while 13% of classified employees identify as Black, Indigenous, or people of color, that number is 23% for temporary unclassified employees. What that says to us is that some of the most diverse positions are also the most insecure with the fewest rights. That's a problem. We've heard from this administration that equity is a priority. In the case of temporary unclassified, the current level of management discretion is clearly incompatible with that equity. Proposal number 4 is around vacation time and the conversion of vacation time to deferred compensation in order to align with other bargaining units. Fifth proposal is around holidays. This proposal would include Juneteenth as a holiday and give another floating holiday credit for members whose holidays do not align with the existing state schedule. Proposal number 6 is a length of service credit, private sector vacation credit. This language provides credit to include contracting and self-employment in regards to vacation accruals. Proposal number 7 is moving the pay equity adjustment from a letter into the body of the contract, making this a permanent feature. And proposal number 8 is overtime, time worked for non-exempt employees. This language creates parity and eliminates the differences in the time worked clause. With that, I'll send it back to Megan for our next set of proposals.
Hey, thanks, Adam. So I'm going to cover healthy workplace proposals first. And a healthy workplace has been shown to improve productivity and employee satisfaction. This was evident to us when Minute members helped more than 35,000 state employees turn their homes into remote workplaces seemingly overnight during the pandemic. The ability to telework ensured that state government would continue to move forward and not grind to a halt. Teleworking enabled Mape members to continue delivering timely and exemplary services to people across the state. Over the past year, we've shown that this virtual world might work better for many, if not most, state employees and agencies. Our experience will help us build a better and healthier workplace to retain current employees and attract new ones. So here are our proposals for a healthy workplace. First, we have some telework language that would update the existing policy and provide the right to participate, and a protocol for employee to supervisor or manager relationship and accountability. We have language for a flex schedule to enable expanded options for flexible employee work schedules. This is intended to apply to ongoing long-term schedule changes and not occasional needs like shifting work hours for a medical or a school appointment. We have respectful workplace language that would build and maintain a workplace that is respectful and professional toward all employees, volunteers, contractors, and other people visiting the workplace and public service environment. We do have some language around discipline that will do that seeks to do four things. First, it will notify the employee of the initiation of an investigation, also the outcome and case closure. It will provide guidance when the appointing authority should utilize third-party investigators, and it will provide removal of letters of expectation and provide union presence at time of discipline. And finally, it will allow for employees to provide medical reason contributing to discipline and also have the investigation redone or rescinded. We'd like to make phased retirement permanent in the contract. We also have some language around emergency paid leave that will incorporate communication into rehearsal of fire, active shooter, and other emergencies to local safety committee objectives. And it will also provide paid leave in the time of an emergency or disaster, both natural and man-made, where the continued operation would involve a threat to the health or safety of the individual. And finally, in this bucket, we've got voluntary retirement incentive to make early retirement voluntary and available at the agency's discretion without a triggering event. So I'm going to switch gears a little bit to talk with you about Mape's mental health and well-being proposals now. Study after study show that benefits such as paid family leave and sick leave can help employees meet their personal and family healthcare needs while also fulfilling work responsibilities. So we have some proposals on these and other mental health and well-being topics that we'd like to share with you. First, we'd like to provide paid family leave. Under paid parental leave, we'd like to increase the amount of time available. With bereavement leave, we want to expand the definition of family and also broaden sick time usage. We have updated language for the sick leave use that incorporates modernity, and it also strikes restricted language. We have a sick leave pool that provides a source of paid sick leave to alleviate the hardship caused when an employee loses compensation as a result of a catastrophic illness or injury. So those are our proposals for mental health and well-being, and I'm now going to go over to Carolyn Murphy, who is a senior accounting officer at the Department of Revenue when she's not acting as our negotiations co-chair. The screen is yours, Carolyn.
Thank you, Megan, and thanks to all of you for your continued attention as we wrap up our proposal presentation with a focus on attraction and retention. You've heard our desire to make the state of Minnesota an equitable, healthy, and productive workplace. Now let's talk about how to attract and retain the kinds of quality employees it takes to construct that workforce. We've heard time and time again that our employer wants to be competitive in the marketplace. The following proposals would help make the state a more attractive workplace and retain those who have already adapted to the 2021 model of working in a global pandemic we've identified gaps in the areas of attraction and retention and request the following proposals to maintain our history of being a productive and successful workforce. Our first proposal under this theme is tuition reimbursement to provide equity and understanding of the distribution of training and development funds for reimbursement. Second proposal, tuition and fee waiver. This language provides for equitable access to education for all state employees. Tuition and fees waived for attending courses held at schools in the Minnesota state system. Our third proposal, severance pay, increases unused sick leave payout at the time of separation from state service. Fourth proposal, deferred compensation increase. This will increase the deferred compensation match and compensatory time bank conversion hours. Fifth proposal, vacation accruals. Increase vacation time for newer employees and the two lower categories of state service. Proposal 6, reallocation and job audits to improve the job audit and reallocation process. Proposal 7, student loan payment reimbursement. This language will provide an attraction and retention tool for the employer. Proposal 8, add a step at the top, drop a step at the bottom, provides salary increases to those at the top of their pay scale and removes the bottom step of the pay scale grid. Proposal 9, allowing returning state employees to maintain vacation accrual rates. This language allows an employee who returns to state service after 4 years to maintain vacation accrual rates and allows current employees to request credit. Megan, I'll turn it back to you for closing statements.
All right, thanks, Carolyn. So in spite of the pandemic, Mape members continue to provide exemplary services to Minnesotans. We provide consistent and thoughtful services without disruption. Over the last 13 months, we didn't miss a beat, and we helped state government continue to move forward during a very difficult time. There are literally thousands of stories and examples of Mape members stepping up to share with you, but these are a few that immediately come to my mind. We have a member who volunteered to drive daily 90 miles round trip from their home in Cambridge to help out at the Unemployment Insurance Phone Center in St. Paul. Despite large COVID-19 outbreaks at correctional facilities in Stillwater, Lino Lakes, St. Cloud, and other facilities, members continued leading therapy groups and other activities at great risk to their own health and the health of their families. We have direct care and treatment employees who continued providing reliable, safe, and sometimes life-saving care for some of Minnesota's most vulnerable, while often short-staffed and fearing budget cuts. We have a Department of Agriculture, temporary and classified employee who helps bring food safety oversight onto state produce farms who can't plan for this future, for his future rather, despite knowing that his position will be needed long after he's gone. So as I said earlier, Minnesota's at a crossroads. The death of George Floyd and the trial of Derek Chauvin has further exposed long existing disparities and systemic racism in our state. We are proposing commitments to anti-racist policies and an emphasis on the importance of equity, diversity, and inclusion in the state workforce. State government has to lead the way on these inclusive solutions. Over the last year, Mape has reimagined the state workforce, the state workplace, and has shown that the virtual world of teleworking might work better for many, if not most, state employees and agencies. Teleworking enabled Mape members to continue delivering timely and exemplary services to people across the state. A healthy workplace, which includes telework, flex time, phased retirement, and other similar policies, has been shown to improve productivity and employee satisfaction. For years, research has proven that benefits like paid family leave and sick leave not only help employees meet their personal and family healthcare needs, but it also affords the safety, security, and predictability in life to continue fulfilling work responsibilities. Our mental health and well-being section also includes bereavement leave and other proposals. The work all of us do affects the quality of life of millions of Minnesotans. We want to make the state an equitable, healthy, and productive workplace. tuition reimbursement, vacation accruals, and other policies will attract and retain quality public servants. Mape members didn't hesitate to step up to help Minnesotans fight this deadly virus that we're still dealing with today. We support the governor's commitment to a fair and balanced budget and his request that all Minnesotans step up and pay their fair share, including the wealthiest Minnesotans and corporations. 5 Minnesota companies saw their profits go up a total of $33.1 billion in 2020. The companies are United Health Group, 3M, US Bancorp, Target, and Medtronic. As Governor Walz often says, collective bargaining and union activism not only improve the lives of citizens in this state, but also lift up everyone else economically. We need adequate resources to do our jobs and provide the services that Minnesotans need. Positions need to pay competitively so we can fill them with public servants ready to do the job. We are proposing a fair cost of living adjustment for our members. It's absolutely necessary. Salaries have to keep up with inflation so we can support ourselves and our families while we support Minnesotans recovering from the pandemic. In our next contract, we need to hold the line on healthcare and preserve our quality and cost of healthcare. We don't want to go backward, particularly now given the vulnerability we and our families face in terms of health risks. Both Governor Walz and Commissioner Showalter have acknowledged the importance of affordable healthcare, and as Commissioner Showalter said, the role it plays in making state employment viable and rewarding. The proposals we've presented today will make a difference to state employees who will make a difference in our work lives. And will make a difference in our work lives. We believe that those who do the work have the right to a voice in how the workplace is run. We do this because we believe that a good contract for state employees raises the standards for all workers in Minnesota. And we do this because we fundamentally believe in striving for the common good and for democracy in our society. And we believe that unions, like Mape, are fundamental to that effort. I know we share the goal of providing the best services to Minnesotans. We look forward to hearing your proposals from the MMB team this afternoon. And we look forward to your responses to each of our proposals and toward finding common ground. So thanks for being here. Thanks for hearing our opening proposals, and we'll see you this afternoon.